A very good evening and welcome, everyone. On behalf of Voice of Healthcare, allow me to extend a warm welcome to all the speakers and the viewers who have joined in for today's discussion. On the occasion of World Lung Cancer Day today, Voice of Healthcare, in collaboration with AstraZeneca, has taken an initiative to bring together the experts and the speakers for a series of resourceful discussions. Today, with our expert speakers, this series of discussions aims to focus on all possible aspects of lung cancer and its treatment in India. Our experts shall talk about crowdfunding and its impact on cancer care accessibility and affordability. On a different series of discussions, we'll also be discussing about different cancer treatment landscapes and scopes of interventions when it comes to Indian landscape, and also what steps can be taken to make cancer care easily accessible to the ones in need. We'll also be having the honor of having direct patient voices with us, lung cancer warriors, and their journey in conquering the disease, and much more. With varied topics to discuss on, let's begin today's rounds of discussions. We commence this session by a short conversation on the topic crowdfunding revolutionizing affordability. And to speak on this topic, we have with us Mr. Kunal Kapoor, who's the co-founder of Ketto, that's one of the India's leading crowdfunding platform. Welcome, Kunal. It's a pleasure to have you.
Well, thank you so much. Thank you so much. It's great being here.
Thanks. So, while I said in the start, we'd be dedicating today's discussion that focuses on lung cancer and treatment accessibility. But before that, why don't we begin by addressing the so called stigma around while we discuss cancer? Now, we normally tend to avoid talking about cancer in public life, which can highly and adversely affect awareness building. How can we possibly change this? What can be a strategy or a hack that you suggest behind it? And also, how can we bring cancer into the public conversation and the narrative in a much more needed attention? Over to you, Kunal.
Well, yeah. So, I mean, unfortunately, there is still a lot of stigma attached to cancer. There is a sense of shame. There is a sense of guilt. I think also there is a sense that this is still a death sentence. Whenever you think of cancer,
Right.
you think there's very little chance that you're going to survive, which is not true because I think medicine has made huge strides, especially when it comes to treating cancer. So that's not true anymore, but that's the thought there is in most people's heads, and we tend to think that and I found that this sense of shame and guilt is a lot more when it's things like breast cancer, cervical cancer, prostate cancer, and we tend to think that these things happen mostly in lower income groups, or we feel like it happens only in small towns. But I used to run a podcast which was interviewing cancer patients and survivors and people, caregivers, and I found something which was very common is that uh, there was a sense of shame and like guilt that we're talking about, even in like middle income and higher income families and educated families, right? I interviewed this one lady who had breast cancer, and she said that when she found out she had breast cancer, her in-laws and her family and her husband said, "Don't tell anyone that you have breast cancer." So she was not only dealing with the disease, but she was also dealing with the stigma. So it is unfortunate that the stigma still exists, and I think the only way to overcome the stigma is to create obviously more education, awareness, have more conversations, public conversations about cancer, about uh, how, like I'm saying, we were talking about is that medical medicine has made so much progress, and it is a disease that is very, very highly treatable if it's found at the right time. And we played a part, which is that we constantly tie up with NGOs, we tie up with hospitals, we talk to patients about cancer, and overcoming the stigma of cancer. And like I said, we recently finished one season of a podcast, which was specifically uh, speaking to cancer patients and caregivers. So I think what's really important is to create a sense of awareness, have conversations, have influential people, have people that whose voices reach out to others, talk about this and help overcome the stigma. It's obviously not something that will happen overnight, but we have to constantly keep building that conversation and building the awareness.
Right. And when you rightly mentioned that it's the matter of fact that we really need to raise our voices, and also to the people who have the sense of power to influence other people. And we have been pretty lucky in that front, that in our industry as well, we have a few influential people who have come up and talking about their journeys and how did they manage to combat the disease. That's one. And also, while you mentioned that low income groups and middle income groups families have a stigma, but also I think uh, families from tier 2 and tier 3 cities specifically have a much more stigma when we compare it to the metro cities and everything. So but then that again talks about how well are we talking about it and how much are we talking about it. And while my second question was, I wanted to ask about a few initiatives that were taken by Ketto to amplify cancer awareness and action. A part of it you've already mentioned, but then if you can elaborate a bit about how Ketto is playing a part in amplifying cancer awareness in India.
So on Ketto now, about over 60% campaigns are medical campaigns, which is that people that need assistance for drugs or treatment or surgeries or fighting a particular disease, and out of which a majority of the campaigns are actually for transplants and cancer. So these
Mhm.
are that need money for the drugs, for the treatment, for the surgery. And we've now had about 25,000 fundraisers on Keto, which are specifically for cancer. We've raised about over 100 crore rupees to fight cancer, and for people and patients and caregivers of people that are fighting cancer. And it's very simple. All you have to do is, if you or somebody from your family is fighting the disease, you can just come onto the platform, create a fundraiser right away. You can reach out to our team and we'll assist you in setting up the page and setting up the story and then reaching out to people, right? So, what we're trying to do is that, we live in a world where medicine and medical expertise has grown a lot, but the cost of it is also grown simultaneously. And there's surgeries that cost 40, 50 lakhs, and that's something that an average person can't afford. So what we are trying to do is to connect people that need help to people that can help across the world. And we found that each time somebody is fighting the disease or is fighting cancer or needs a transplant and uses the platform to reach out to people, there's thousands of people from across the world that come together to contribute and help this person. So I think crowdfunding is a really sort of powerful medium. It is about democratization of capital. It is about connecting people that can help to people that need helping. And if there is somebody out there that needs help, please reach out to us, and you'll find that it's a really sort of powerful way of raising money for any sort of medical need.
Right, and it's really amazing that so many number of people are using medical crowdfunding platforms for causes such as raising awareness and raising funds for cancer care and cancer treatment, and maybe the post palliative care as well. But there are so many cases still out there who maybe or may not be diagnosed. That is number one. We do not yet have very much access to timely and quality access of screening and diagnosing of these diseases. That is, I think, one way where crowdfunding can also take part. And also, yeah, as you mentioned, that 25,000 is one, and there are so many people who still have lack of access. And by raising such voices, we can at least help them amplify to raise awareness, and let at least let them know that this is also a way where they can, have access to care. So,
Yeah, the
please.
hospital last week, and this is a pediatric hospital, and the doctor told me something which was very interesting. She said that 30% of the BMT cases uh, now funded in that hospital are because of crowdfunding. So if it wasn't for crowdfunding, there would be a large number of cases and large number of children that wouldn't have access to treatment.
Right. And as I said, that my next question was around how healthcare fundraising platforms can change the game when it comes to cancer care more affordable. But I think you've pretty much answered that part of it. But what is your take, or maybe one liner that you can mention about just medical fundraising in general? How Can platforms like these change the game when it comes to cancer care affordability?
So, obviously you can't change the game. You can, but I think you can have impact. You know, we have cases on our platform every day which are getting funded. And, for instance, I remember there was this auto rickshaw driver, his name was Arun, and his daughter was diagnosed with a very, very sort of rare form of cancer. And 15 lakh rupees for her treatment. And I think he was making like some 10, 15,000 rupees a month. So when you're making 10, 15,000 rupees a month, you can't obviously even dream of 15 lakh rupees, right? And the doctor suggested that he try crowdfunding. And within 2 weeks, 1,200 people came together and funded the campaign. Uh, so, because of crowdfunding, he had access to treatment. His daughter got better. And that would have not been possible if it wasn't for medical crowdfunding and for the kindness of, millions of people across the globe. So, uh, Arun is just one example. There's, like I said, thousands and thousands of people that have raised money on our platform and many other platforms and have been able to access treatment and access uh, care which they would have otherwise not been able to get.
Absolutely. While on point, and my last question to you would be any personal message for the audiences on Lung Cancer Awareness Day? Just a general message to all the survivors out there, or also to the people who are combating the disease. Anything.
Well, it's very difficult to say something to somebody because they are the ones that are uh, they're the ones that are fighting this, and they're the ones that have overcome this. So they're a lot braver than I ever will be. But I think it's very, very important if you are, like we were talking about the stigma to begin with,
Mhm.
if it's that you're fighting, I think it's very important from all the people that I've spoken to, all the cancer survivors, all their caregivers. It's very important to talk to people about it. Tell them that you're going through this. It's no point, hiding that you have this and you're fighting it. There's no point feeling a sense of guilt and shame. I think when you share it, it becomes much easier, and it's also when you share on a platform like us, if you are somebody that is struggling for funds and you come forward and share what you're going through, it's very likely that people from across the world will be able to come together to support you not only with funds but also with just kind words and just encouragement. So I think that sense of stigma that people have, that's something that they should get rid of, and come forward and talk about it.
Right, right. Yeah, so when it comes to not just lung cancer, any cancer awareness and treatment, I think raising the voices is the key to begin with. So, yeah, thank you so much, Kunal. Thank you so much for sharing your insights with us on this specific topic. And it was a pleasure to have you. Thank you.
Thank you so much.
Thank you.
Take care.
So that was Kunal Kapoor, who was the co-founder of Ketto, who has shared his insights and also a bit about how medical crowdfunding can possibly affect and play a role in cancer treatment and possibly change the game. Now, moving on to the next part of this discussion, we have Miss Vandana Gupta. She's the founder and chairperson of We Care Foundation. Welcome so much, ma'am. And with her, we'll be talking about building and mobilizing patient cancer advocacy in India. So, to talk about it, I think ma'am would be the right person. Over to you, ma'am.
Thank you, and thank you for the initiative that you are bringing up for lung cancer. Because though lung cancer is a common cancer, but it is always characterized with a lot of negativity. There is poor prognosis, and it is stigmatized by association with tobacco and related lack of research investment. We, as committed patient advocates, should work towards overcoming this. That is my uh, thought about it, and I feel that cancer advocates should work to improve the lives of people with cancer. They can do it with many ways. It's not just raising slogans that makes all the difference, but supporting those living with cancer, raising awareness about cancer and related issues, advancing cancer research, improving the quality of cancer care, and addressing governmental issues affecting cancer care and research. It is important to do these things. Many people find cancer advocacy to be a positive and empowering experience. Become interested and to become a good cancer advocate, start by finding opportunities that match your interests, skills, and whatever you want to do. Now, cancer advocates guide current patients through the experience, but more helpful in this role are cancer survivors, because when you talk to a survivor, you are able to identify more. You can support by visiting somebody who has been recently diagnosed with cancer, and then listening and sharing those stories. That's extremely important. So the role of the cancer advocates come in there, that you've got it and you've made it together. Cancer advocates raise awareness at local and national levels by educating the public about cancer, expressing the importance of cancer screening and early detection. We keep talking about breast cancer screening, keep talking about cervix cancer screening, but rarely do we talk about lung cancer screening. So that is extremely important. And then, groups like insurance is a disparity. We don't get enough insurance in our country for the cancer patients. So if we can talk about removing these disparities, or even after job discrimination, I know of many cancer patients who, though they have recovered, are finding it difficult to go back to their job situation. And then I think media plays a big role in this. That if the media can talk about cancer and can talk about the issues which cancer brings in, whether it is good, whether it is the financial thing, whether it is money for research, whatever it is, but media has to educate. We know that cancer research is expensive, but advocates can plan and participate in fundraisers. They can donate money directly to cancer groups, or they can donate money through a workplace program. In the workplace, there can be like from the salaries, or it can be a program that people are planning to do, and that money can be accumulated towards lung cancer. And also, if we can help in buying things which are a percentage of which can be given to the cancer patients, to the right, to make lives better for cancer patients, I think that will really help. And some patient groups work fluently with a number of patients involved in clinical trials. Individual patient advocates may be involved in doing the research grants, assist with developing clinical trial protocols, and help create clinical trial consent forms. So I'm saying that the role of a patient advocate is in many folds. It is as simple as talking to people, creating awareness, helping in screening, helping in education, moving on to the media and the fundraiser part of it, and then going on to the research part, and also talking about clinical trials, and then talking to helping, not only talking about the clinical trials, but also helping in developing those clinical trials. Because as patient advocates, we can become the bridge between the doctors and the patients, so that the doctors know what they want to do in their research, and we as advocates can tell them how to do it, how to convey it to the patient to get the best results. Because very often the patients get scared and do not like participate in the whole thing. We know that smoking is a trigger for lung cancer, but it also causes many other cancers and heart diseases. But unfortunately, lung cancer is what is stigmatized all these years, and hence very often it is underfunded. And since it is associated, that lung cancer is associated with smoking, often people believe that people get lung cancer only because of smoking, and so they feel it is a change of the behavior that has to be implemented, which is correct. Before you get lung cancer, you can make the changes in your behavior. But once you have lung cancer, then the money should not given to those patients who are lung cancer patients, because it was a behavioral thing that had come about. So changing the stigma around lung cancer can have very important impact on individuals who are diagnosed with the disease. Although lung cancer claims more life than colon, breast, and prostate cancer, I'm sure the doctors here will agree with me, but it is lung cancer which gets less funding than the other three cancers. So that's my thing, that lung cancer has to be equally important, and lung cancer has to be given all the dues that it deserves, so to say.
Well, thank you so much, ma'am. Thank you so much for sharing your views. It was a pleasure to have you.
Yeah, but Khushbu, I just want to add one more thing, that
Sure, please.
if we know that lung cancer is detected early, it can be operated, and once it is operated in the early stages, and the chances of recovery are very, very high. So people should be aware of it, and they should not fear and not go for surgeries, and take that decision. And secondly, we always think that lung cancer is a man's disease. It doesn't affect women, which is not true, because we have found, I mean, not in India, but research abroad has shown that because of the awareness amongst men for lung cancer, the rates of lung cancer in men have come down, but in women it has gone up, which means that women were ignoring their health and men were cautious. So we need to tell everybody that it is not just a men's disease, and women need to be equally cautious. And we also want to tell everybody that lung cancer can be, can be affecting anybody and everybody, and so everybody deserves the sympathy and support that can be offered.
Right. Thank you so much, ma'am. And I believe that your voice would reach the ones in need. Um, so it was a pleasure to have you, ma'am. Thank you so much.
Thank you very much.
Now, moving on to the next part of this discussion, as I said, that we have an honor of having a lung cancer survivor amongst us, who is Mr. Om Prakash Chauhan. So over to you, Chauhanji. You can please come up on the screen and share your journey with us. हाँ जी, please बोलिए चौहान जी. You're on the screen.
सभी उपस्थित खुशबू जी, आप लोगों ने मुझे सम्मिलित किया। सामान्य सभी को मेरा नमस्कार। मुझे मार्च 2020 में 18 मार्च को सीटी स्कैन से कैंसर या टीबी का डिटेक्ट हुआ, मेरी बायोप्सी हुई और 22 तारीख को मेरे कंफर्म हुआ कि मुझे राइट लंग कैंसर में कैंसर है। मैं तुरंत महात्मा गांधी हॉस्पिटल में डॉक्टर अजय यादव जी से संपर्क किया और उन्होंने तुरंत दूसरे दिन मेरी पैट स्कैन करा करके और कंफर्म होने के पश्चात 23/3/2020 को मेरा रेडिएशन और कीमो स्टार्ट कर दिया। इसी तरह मेरा 30 रेडिएशन हुआ जो 4 मई 2020 को खत्म हुआ और उसके बाद में पैरेलल 6 कीमोथेरेपी भी हुई और 25/5 को मेरी हाई डोज कीमोथेरेपी के लिए डॉक्टर साहब ने सजेस्ट किया और मुझे भी इस बात की चिंता थी कि पता नहीं मैं हाई डोज कीमोथेरेपी झेल पाऊंगा नहीं झेल पाऊंगा, लेकिन डॉक्टर अजय यादव जी को मैं धन्यवाद दूंगा कि उन्होंने मुझे इस बात के लिए कहा कि मैं आपके साथ हूं, आप चिंता नहीं करें। और जब मेरी कीमोथेरेपी उस दिन 27/5 को पूरी हुई, मुझे खुशी हुई इस बात की कि मैं बाकी 3 भी झेल लूंगा। इसी तरह से मेरी 3 और कीमोथेरेपी हुई। 27/7 को मेरी लास्ट कीमो 20 को लास्ट कीमोथेरेपी थी और उस समय मेरा वजन घट करके 62 किलो से 38 किलो हो गया था, लेकिन फिर भी मैंने इस कैंसर की लड़ाई से लड़ा और हिम्मत नहीं हारी और मेरा महात्मा गांधी हॉस्पिटल के कैंसर हॉस्पिटल के डॉक्टर्स, पैट स्कैन के, रेडिएशन के गोयल साहब, इन्होंने मेरा पूरा सहयोग किया। बीच में मेरी स्थिति ये हुई कि मुझे खाने में प्रॉब्लम हुई तो गोयल साहब ने मुझे इस बात के लिए कहा कि आप नलकी नहीं लगाएंगे तो आपके लिए बहुत बेटर रहेगा और मैंने नलकी नहीं लगवाई और उसके पश्चात जैसे तैसे मैंने मेरा हीमोग्लोबिन, प्लेटलेट और खाना खा करके मेरा ठीक रखा। 18/8 को 2020 को मेरा पैट स्कैन हुआ और मेरी अच्छी प्रगति हुई। मैं सभी के डॉक्टर्स के सहयोग से, मेरे मित्रों के सहयोग से मैंने हिम्मत बांधे रखी और मैं आज 2022 में आज आप लोगों के समक्ष हूँ। मैं वही मेरी जो दिनचर्या थी, सुबह 10 किलोमीटर घूम करके अनुलोम विलोम प्राणायाम करता हूँ। मैं सभी कैंसर पीड़ित लोगों से भी इस बात के लिए कहूंगा कि कैंसर कोई बड़ी बीमारी नहीं है। अगर पेशेंट हिम्मत रखे, पेशेंट बाबा या देसी इलाजों के चक्कर में नहीं पड़े, तो मैं कहता हूं कि अगर डिसकंटिन्यू जिस पेशेंट ने किया है वो कभी भी जो मौत का दर्द होता है वो उसका मौत नहीं देख सकता है। उसका उदाहरण मैं स्वयं हूं कि मुझे भी लोगों ने बहुत सजेस्ट किया कि हिमाचल जाइए, वहां जाइए, लेकिन मैंने एक भी दिन रेडिएशन और मेरी कीमोथेरेपी मिस नहीं की और धीरे धीरे मैं 1.5 साल में जा करके रिकवर हुआ। मैं महात्मा गांधी के सभी डॉक्टर्स, अजय यादव जी विशेषकर, पैट स्कैन के हमारे डॉक्टर जो हैं तरुण साहब, रेडिएशन के गोयल साहब, इनका बहुत बहुत धन्यवाद देता हूं। और मेरी तरफ से संदेश देता हूं सभी, अगर किसी को डिटेक्ट हो जाता है कैंसर, तो उनसे इसी बात का अनुरोध करता हूं कि वो बीड़ी, सिगरेट इत्यादि नशे पते से दूर रहे और दूसरे साथियों को भी इस बात के लिए कहे कि वो इस तरह के नशे पते को छोड़ करके और इस बीमारी का इलाज करे। आज की तारीख में देश में कैंसर कोई बहुत बड़ी बीमारी नहीं है और पॉजिटिव लोगों के साथ हम रहेंगे तो हमें अवश्य सफलता मिलेगी और इस बीमारी से छुटकारा मिलेगी। मैं भारत सरकार और राज्य सरकार से भी इस बात का अनुरोध करता हूं कि ऐसे लोगों जो वैक्सीन के कोरोना के टाइम में वैक्सीन का एक निदान, वैक्सीन का इजाद करके निदान किया, कोरोना से दिलाया, तो उसी तरह से, क्योंकि मैंने जो पीड़ा देखी है कैंसर के दौरान कि वो पीड़ा बहुत ही दर्दनाक पीड़ा होती है कि कीमोथेरेपी लगते समय कोई पीड़ा नहीं होती, रेडिएशन होते समय कोई पीड़ा नहीं होती, लेकिन शारीरिक कष्ट जो देखना पड़ता है उससे निजात मिले, कोई वैक्सीन का इजाद हो और लोगों को इतनी पीड़ा का कष्ट नहीं उठाना पड़े। उन्हें मैं महात्मा गांधी हॉस्पिटल के सभी डॉक्टर्स का, स्टाफ का, जिन्होंने मेरा मनोबल बढ़ाए रखा और मैं एकदम ठीक हूं, मुझे अभी कोई तकलीफ नहीं।
थैंक यू सो मच चौहान जी, बहुत ज़्यादा अच्छा लगा आपको सुन के और आपकी बातें जिस हिसाब से आप बता रहे हैं, दैट इट वाज सो इंस्पायरिंग एंड हेल्पफुल फॉर ऑल द अदर पीपल एज वेल हु हैव लिसन्ड टू इट। थैंक यू सो मच, इट वाज अ प्लेजर टू हैव यू। Thank you, Chauhanji. Now, moving on to the next part of this discussion, we have our expert panelists who will be speaking on the topic improving early detection of lung cancer in India. And to speak about it, we have our expert set of panelists with us, whom I'd like to introduce. We have Dr. Aparna Sreevatsa. She's consultant medical oncologist at Nanjappa Healthcare. Welcome, Dr. Aparna.
Thank you, Kushbu.
We have Dr. Shirish Alurkar. Sir is consultant medical oncologist at Apollo CBCC Cancer Care, Ahmedabad. Welcome, Dr. Shirish.
Yeah, thank you. Good evening.
Good evening. We have Dr. Lalit Mohan Sharma. He's senior consultant hematologist and medical oncologist at Shriram Cancer Center, Mahatma Gandhi Hospital at Jaipur, Rajasthan. Welcome, Dr. Lalit.
Thank you. Thank you so much on this great occasion, and I think we will do best possible efforts to make everyone aware about the lung cancer.
Right. Thank you so much, Dr. Lalit, and welcome. We also have Dr. Kripa Bajaj. She's consultant medical oncologist and cancer genetic clinic at Basavatarakam Indo-American Cancer Hospital. Welcome, Dr. Kripa. I hope you can hear
Thank
us.
you for the introduction. Today, are you able to hear me?
I am absolutely able to hear you. You
Hello?
can please go on. And also, I'll just like to let everybody know that Dr. Kripa would also be leading this conversation by moderating this discussion. So over to you, Dr. Kripa.
So, I welcome to my esteemed panelists, Dr. Aparna Sreevatsa, Dr. Lalit Mohan Sharma, as well as Dr. Shirish Alurkar from Ahemadabad,
Thank you.
Shimoga, as well as Jaipur. So today for the theme of the discussion today is regarding spreading the awareness of lung cancer in India. I'm sorry that I'm not switching on my camera because my internet is so unstable. I couldn't hear when I on the camera. Is it okay for you?
It's okay.
Hello?
Yeah,
sure.
it's okay.
So the theme for the today discussion is, why is lung cancer not prioritized for screening? How do we increase collaboration with healthcare workers to increase screening and referral? What are the importance of using newer techniques to improve patient journey like AI, telemedicine, social media? And how quality of life matters in lung cancer, be it mental and physical. These four are the theme of discussions today. We are going to discuss in depth in it. How can we improve the lung cancer screening and lung cancer awareness in India? So, my first question I posed to Senior Medical Oncologist Dr. Lalit Mohan Sharma from Shriram Cancer Center, Jaipur. Sir, how you are screening your patients who are at high risk? What factors you are considering when in patients to do screening in lung cancer?
In fact, honestly, we advise for low dose CT scan in patients who are having heavy smoking and some symptoms. But most commonly, as cancer specialist, patients do come to us only after developing the cancer. In fact, before development of cancer, we rarely see patients in our clinics. But it has been attempted that in heavy smokers, if we do X-ray, it does not carry much meaning. But if we do a low dose CT scan, that helps. But again, lung cancer screening has not been very rewarding, in fact, worldwide. So still we are seeing a lot of advanced cancer cases, and we always advocate that whosoever is smoking, at least a low dose CT scan we advise for early detection.
Perfect, sir. Points taken. So, as such, now you are not screening people now. People are getting diagnosed and coming to you.
Yes, very right.
Aparna Srivastava, what's your yeah? Aparna
Yes, I
Srivastava,
agree
what's your
with
take on this and what's your experience?
yes, I agree with
Hello.
Dr. Lalit sir that yeah, can you hear me? Yes, right?
Yeah, I
Yeah,
can
Hello?
hear
please go
you.
ahead.
Absolutely.
Yes, I
Yes, I
agree
can
with
hear
Dr.
you.
Lalit sir. Yeah. So most of my practice is usually treating the patients who are already diagnosed with lung cancer, and I think we have to kind of give a relook to the screening of lung cancer in India. If screening has to be done, it has to be done by the primary healthcare physicians and not the oncologists, because by the time patient comes to an oncologist, it is a very highly specialized care. The oncology is very highly specialized, and when patients get diagnosed, they come to an oncologist. So I think it's time we sensitize our primary care healthcare physicians, and also the general medicine the physicians who are working in the clinics, and they have to pick the high risk population, who is these smokers who have smoked for more than 20 or 30 pack years, or those who had some occupational exposure and who are at high risk, and they have to promote and advocate that they have to undergo a low dose CT scan annually. But as sir said, it's not a very easy thing to do a screening. The patient has to accept the false positive, false negative rates that are associated with it, and also the need for a biopsy or a surgery. And then even after biopsy, they may find some lesion which may be benign. So all that the patient has to understand and then sign up for screening. And it is not a very easy thing to motivate a patient to get a biopsy or an FNAC. In my practice, I see patients who have frank features of lung cancer, who refuse to, they are scared of biopsy, they're scared of treatment. Sometimes they even, when they come to know that they are in stage 4, they even refuse treatment, and they shun away. So I think it's a very difficult task, and we have to consider it with a pinch of salt. And I think early detection may be an easier task compared to screening, where, as sir said, patients who are already having some symptoms, suppose they come with cough of more than 2 weeks or something, we should promptly do a CT scan and detect the cancer early, rather than screening for lung cancer. That's what I feel.
Thank you. Thanks for the inputs, Aparna Srivastava. Dr. Shirish Alurkar, so what are the challenges you're facing? Like, are you getting any patients from the family members or someone like this saying they're having heavy tobacco addiction, Can you please screen like this kind of patient? Are you getting in a hospital in Ahmedabad?
Oh, not at all. In fact, there's a big taboo for screening. You just see the screening for breast cancer. I mean, for mammography. It's not easy to
Correct.
convince a lady to go for a mammography. It's very difficult. I mean, screening for a lung cancer, I would say, is way beyond the the realm of practical the thing. One thing is it's
What's your thought?
on what? Sorry,
Like you
sorry.
rightly pointed out, it's felt as a taboo. Are you able to hear me,
Mhm.
sir?
Yeah, I can hear you.
Yeah.
Yeah,
So you mentioned it's a taboo. So why you think lung cancer is not as prioritized as a breast cancer in the population? Is it the patient's fault, or is it the patient? Is the clinician's fault? They're not encouraging patients to undergo screening. What is your
see,
thought on this?
you
Why
can't
it's
say
not materialized much?
See, you can't separate patient and clinician. We are part of the society, right? So all of us are responsible,
Correct.
including the politicians, including the clinicians, including the hospitals, including the corporate hospitals. So everyone is part of the whole picture. So it requires a very combined approach for everyone. It requires political will. It requires will from the patient. And rarely see any person coming. Mera CT scan le lo. The patient doesn't come. It's practically not there.
Okay. So whenever any patient did any single patient come to you like for screening these days? Any patient? I'm just asking. Want to
No,
take opinion of the patient? Why?
no, no
So
patient has come.
have you? So three of the doctors in our panel, no one has done screening for any patient. If ever they want to done, they would have done NCCT thorax, low dose NCCT thorax. So that's the final discussion regarding the lung cancer prioritization in India. Is all the panelists agree with the same conclusion?
Yeah,
Yes.
Yes. Okay. Perfect. Perfect. I too replicate with the same. So, if ever the screening has to happen, so what factors you consider? Will you take USPS preventive task force criteria in India? Will that be applicable? The US guidelines to India. So, what's your take on that? How it should be for Indian setting? Because a lot of tuberculosis, a lot of infections are there. False positive rates are much higher than what we see in Western population. So, what's your take on the replication of USPTSF criteria in India?
So,
Dr.
Dr.
Lalit Mohan
Prakash,
anyone?
Sharma, please take this
Okay.
yeah,
question.
thank you. In fact, I feel that the US medical guidelines are not applicable to us. We have our own set of problems and we are different than the US healthcare system. Here, when it comes to ground realities, many times, even when a general physician is asking for an X ray chest, patients do crib that I will not do this, why should I do it? So, the Indian scenario is totally different. So, it cannot be a US guideline, and especially screening like lung cancer. I don't think it is feasible in India because we see a lot of advanced cancer cases. Most commonly, these patients they go to physician or they go to pulmonologist, and we try to advocate them that they should undertake CT scan before concluding that this is tuberculosis. So that remains one practical aspect. But screening in India for lung cancer, I think, will not be a feasible option. We have other preventable disease. Take example of HPV vaccine, highly preventable for cervical cancer and other things. Breast ka mammography you take, pap smear you take. So we have priority for these cancers. And lung cancer, I don't think screening will be an effective, cost-effective tool in Indian circumstances.
If ever it was done by primary physician with low dose CT, so what will be the challenges we may face, sir? Like as I mentioned
I,
before, infections
I
are there. So if ever they have done, yeah, please, sir, go
I
ahead.
think it will be a huge burden on the healthcare system, in fact. So, if you see reality, we are distributing drugs for tuberculosis free. And if we advise for a CT scan, low dose CT scan screening for a population where we have huge population and the smoker population is more than 25% of the total population probably. So it will not be a cost effective measure and if by detection of early lesions, we will not be able to, in fact, justify. So I don't think it will be a cost-effective, practical model for screening of lung cancer by MDCT.
Can I
Oh,
just
thank you, sir. Thanks for your inputs. Dr. Shirish Alurkar, you also going to say something?
Yeah, just want to just pitch in. See, one thing about screening is the voluntary, the inclination of a person to come forward and get screened. Now, in India, there's a lot
Correct.
of taboo with this, so it's going to be very difficult. The patients doing every 3 monthly or 4 monthly a low dose CT scan, and if there is something coming up, say a small nodule, what do you do with that? You follow up the amount of stress, as Dr. Lalit Mohan said, the stress on the medical and the health system. It's too much. So I think screening as of now, maybe next 5 years, is almost a no-no.
And one more thing is that to the
Okay.
feasibility,
Thank
one
you.
is the cost effectiveness. Yeah.
Yeah.
Yeah, the other one is the feasibility. So to do a CT scan in the at the population level. So in India, nearly 65% of the population is in rural areas. So in such a place, in many primary healthcare centers, we are not even having X-ray facilities. So how do we manage CT scans in such places? And if we ask someone to travel to some far off place to get a CT scan, I don't think they will do it or they'll be interested to do it. So I think such issues are to be addressed. To strengthen our infrastructure, the healthcare infrastructure needs to be strengthened. When we have the facilities, then only we can promote such facilities for screening.
Thank you so much for the input. So, as of now, the screening will not be applicable in India because it's a huge burden to our country. Healthcare wise, false positive rates increase the anxiety of the patients, and also the physicians play a very key role in the screening. This is the conclusion of the first theme. And as all of you rightly mentioned, the primary healthcare practitioners are the crux in the management of the lung cancer, like to detect in the early stage, because all of us work in tertiary care center where we can't screen. Most of the times we get referred from the physicians to manage. So, how can we enhance the capability of any peripheral center to increase the screening? So, what can be a part of oncologists in the community to increase the gap of communication between the healthcare worker, the primary healthcare worker, and the oncologist? How can we sensitize them? Can Dr. Lalit Mohan Sharma, can you please pitch in now?
Yeah, I think that remains a better option. We educate, we sensitize the primary care physician or at least the district level hospital where facilities are available. So we advocate them that at least they should screen these patients, and in any symptomatic person who has got chronic cough, blood coming out of the cough, hemoptysis, we call that, weight loss, change in the voice, all these symptoms may mimic lung cancer. So we advocate
I
that
switched
at
on the
that
camera.
level at least screening should be done, and the screening may be again low dose CT scan, and cost effective way will be that we try to develop a system where we don't need films also. In fact, the soft copy may be issued so that it can be done in a cost effective way. So that remains one possibility, but again I'll emphasize that screening in lung cancer it looks very very difficult to.
Thank you, sir. Thank you so much. Dr. Sirish Alurkar, can you please pitch in now and give your
Yeah.
opinion regarding bridging the gap between oncologist and healthcare, primary healthcare worker for the community care?
It's a huge gap as of now. When I can't see both ends as of now, where the other end is. A thing about sensitizing the primary healthcare. Okay, you primary healthcare centers or PHCs. Okay, you've done a CT scan. You found a nodule. What is the next step? Biopsy. We need good intervention radiologist doing a good biopsy because these are all supposedly small lesions, right? So we need good intervention radiologist,
Correct.
which is costly. We need good histopathologist to diagnose that. And suppose you miss a case, you I mean, a small tumor, it can really miss it, and you have a negative biopsy. So all these things require a lot of standardization procedures. So it's not just looking at a CT scan, you find some nodule, and then okay, this is a lung cancer or something. It's not that easy. A lot of other things are implied. So as Dr. Lalit Mohan Sharma said, I don't think screening is the thing right now, at least for the next 5 6 years maybe.
Okay. So, at least for detection from the healthcare workers, how can we communicate with them? Like, how can we increase the awareness in healthcare workers? Because it's very often for us to see people using ATT for 3 to 6 months. And initially, when it got started, it's just a stage 1 or stage 2 cancer. By the time it reaches, it becomes stage 4. So, how can we decrease that knowledge gap between healthcare workers who is the primary physicians in the community? It's very
Can I
common
take
for
that
us, like,
question?
to treat as an autoimmune disorder. Yeah, please, sir. Please, sir. For you only, I pose the question.
Sorry. So, okay, bridging the gap, I would firstly say we can't even diagnose a full-fledged lung cancer, CT scan. We means I'm saying all of us, we are all involved, the radiologist, the primary healthcare physician. We have seen cases where they have come with a definite mass in a CT scan, and it's going on, taking tuberculosis treatment. Even biopsies has been done has been negative for some reason. So unless that, even the basic diagnosis of lung cancer is not there, not done properly, unfortunately. So screening is way, I think, far away still. Yeah,
Okay,
Dr.
thank
Bajaj.
you, sir. Dr. Aparna Sreevatsa, what's your take on this? The same question.
I think the why they are diagnosing tuberculosis is because they have made this rule that any cough more than 2 weeks they have to get a chest X-ray. At least they are doing a chest X-ray and they are finding something, and they do this AFP and other things, and they kind of make a tentative diagnosis as tuberculosis. So similarly, I think for cancer symptoms, we have this national cancer program also. So in that, maybe we should sensitize the healthcare workers in at least early detection. When patient is coming to us with symptoms, that is a stage where he is vulnerable, he has symptoms, so he is concerned about it. So I think we can sensitize them that if the patient has these symptoms, when you do an X-ray and you find that it may not be tuberculosis, maybe next step is to do a CT scan. And if the infrastructure can be strengthened and the availability of CT scan increases, then maybe they go another step forward, do a CT scan, and then do a biopsy and so on. So I think what our healthcare infrastructure has to do, I mean, what we have to do is to come up with the onco centers in tier 2, tier 3 cities, where from primary healthcare PHC, we have a CHC, community health center. And so as we move up the hierarchy, the government should try to set up onco centers where you give all the specialists who can give the, like, an intervention radiologist and oncopathologist, and then they can take the step forward. And I think screening is too optimistic, and it's just bookish, and it's very tough in the today's scenario.
Thank you. Thank you so much. So, all cause is for both head and neck cancer as well as lung cancer. 80% of the times it's tobacco. So, what's your take on this? How can we sensitize the people for de-addiction of tobacco? So, what measures we can take as a society? USCC has come up with many ideas. Unfortunately, India couldn't implement any of the USCC ideas for tobacco prevention, de-addiction, and everything. Dr. Lalit Mohan Sharma, I think you're the right person to say. You're the very senior amongst all. So, what can be done for tobacco de-addiction awareness in the population as a community care?
I think that remains the main point of discussion, in fact, on the lung cancer or head neck cancer day. And we all understand that most these patients, they are having a habit of smoking, maybe active or sometimes maybe passive. Again, here I'd like to emphasize about passive, that if I'm smoking and my wife is sitting with me, she's not smoking, the smoke will go and affect her also. So the passive smoking also equally dangerous. What measures we can take as doctors? We need to sensitize the community, and sensitization means, if you talk only about awareness alone will not help much, because most smokers, they know that this can lead to cancer. So most smokers, they know that smoking can lead to many diseases including cancer. So awareness alone will not be effective. What we need to generate, like I'm working on this field for last more than 20 years, And now I try to sensitize the children. I'm going to schools to deliver talks, and I sensitize children so that they can pull cigarette and bidi from their papa's mouth. In fact, they have that power. So I sensitize children. So if we are able to sensitize the children, we are able to sensitize the daughters, females, at least they can do some active role. Male community per se in India is tough to handle. Dr. Shirish will agree with due respect to all males, but it is difficult in fact. Every time they make promise whenever anything goes wrong, they make promise, आज के बाद कभी नहीं लेंगे, and again they restart within 2-3 months. So that is very, very common scenario. So I think sensitization at community level, that we the mass media campaigning about the hazards of smoking and showing them pictures, which the government is also doing, and from government side there needs to some regulations again for that. So government regulations, including like Himachal Pradesh has stopped they have started the tobacco licensing. In fact, so it is like a liquor license. They have started the tobacco licensing, so nobody can sell without attaining that license. So that remains from the government side also, that the political will is a must at the societal level. If we talk about the major problems of
Thank you,
why it
Dr.
is
Lalit.
happening,
Very
okay, thank you.
no, sir. I'm actually about to ask you the question. One more question. So, government
Yeah.
is like doing active campaign. Mukesh ji is there in every theater before the movie. Mukesh ji will come start his soft story. But still, people are unable to quit tobacco. Even the patients who got diagnosed with head and neck cancer with tracheostomies too. When I was working in Tata Memorial Hospital, roadside patients who come from UP and Bihar with tracheostomy in situ, still they smoke from the tracheostomy tube. They're so addicted. So, what can we do for a de-addiction, and how can we increase the patients to comply to de-addiction center, de-addiction measures? What can we do? Even patients diagnosed with cancer are not so compliant to de-addiction.
That is very, very relevant point, Dr. Kripa. In fact, we also face, and in our clinical practice also, we see that most patients who develop tobacco-related cancers, even they do smoke outside and come to our clinic, and they will say, "Sir, ek do bidi pita hu, ek do cigarette pita hu." That is very, very common. So it is the mainly psychological dependence, and partly this is physical dependence also. So what we need to do in each cancer center or each district level hospital, we need to have a de-addiction center. That the government's effort should be there. It is not effort by the clinicians in fact. So if we have de-addiction center, we depute some psychologists, we depute psychiatrists who have some measures, and there are some the substitutes are also available, medically approved substances. So one can use that. But as clinicians, we failed in fact to convince patient, and we failed to convince to their first degree relatives also. Like if I see a person who has got lung cancer, I ask him that at least you go and allow everyone to quit. You give positive message so that the other family member do not come with a case file of cancer again to me. But they fail to do so. So yet we don't find a effective way to convince the common man. Even patients themselves, as you rightly mentioned, are using that. So de-addiction
Yes.
strategy and government ka policy should also be there somehow.
Dr. Shirish Alurkar, you are from Modi ji Arena. So please tell me your inputs regarding the same. So yours is no alcohol state. I'm not sure how many are not having tobacco, but what's your take on the community care as per the tobacco addiction concern?
Okay, so I mean, respective of the party here, I will not go into the politics. It is difficult to motivate a patient not to stop smoking. They usually stop smoking only when they get cancer, right? That's the bottom line. So, and even his close relative, if they are smoking, they know that this mera bhaiya or whatever has got cancer. They don't stop smoking. So it's very difficult. A lot of efforts, a lot of maybe multimedia or social media, whatever you call it, has to take part. The government initiatives. So a lot of thing has to be done. Another thing is that, yeah, if you see, unfortunately, I would not comment on the policies of the government, but even patients who have been smoking or eating tobacco, they still get free treatment. This is, I would say, is ridiculous. You have this yojnas and whatnot streams. You have the
So
similar
insurance decline when the patient is having tobacco addiction. They do
exactly.
decline regarding the treatment.
If I
Yeah.
have a private insurance, a private company, so I'm smoking. The moment I write I'm smoker, all my benefits are gone. So why should we have
Yes.
the same thing for these people? That is where political will is required.
Very well. Very nice point you made, sir. Yes. Yes. Please go on. Like, so what about the de-addiction? So
De-addiction. Yeah, carry. Sorry.
no. So you made a point that like we should make a public policy regarding this health policy so that people will be afraid to take tobacco so that if ever they get cancer, they can't get treated. So that's a
Right.
wonderful thing.
Mhm.
So only this would be the motivation for de-addiction or something else you suggest to the primary care physicians or at the community care level.
No, I would not say only one point. There are where the multitude of inputs will be required for de-addiction. It's all difficult to say in a small, 1 minute thing, but everything it requires from the PHC, from the primary healthcare, from the oncologist, from the social workers, a lot of things are required. So this would be one of the incentives, I would say. And these boards and these, sort of banners or standees should be put up in all hospitals that if you are a smoker or tobacco chewer, you will not get the benefits. So these are the things which I was just thinking loud.
Yes, yes. It's a very nice point you made actually. So, Dr. Aparna Sreevatsa, you're from a southern part of India, like Shivamogga. So, tell me your take on this. How people are addicted to it? How can we make people aware regarding tobacco side effects and de-addiction? So, what's your policy? What will be your take to improve the community care?
Actually, here in the place where I work, tobacco-related cancers are very rampant, and I see equal number of head and neck, esophagus, and lung cancer. And it's very, as the other panelists said, it's very tough to sensitize the patient to stop smoking, and I think we talked so much about screening in the earlier sessions, and it is seen in many countries that just by stopping tobacco, making people quit tobacco, we get lot of benefits. It's more cost effective than doing a screening campaign for smokers. So it's a very important thing, and I personally feel that our as sir said, the social media and these celebrities or politicians, they're all in a very important positions, and they should do the campaign like when COVID vaccination and other things come up, they bring Mr. Amitabh Bachchan for campaigning. So why not bring such celebrities for campaigning against tobacco? And this they just put in movies. So movies in India are an integral part of our life. Everyone, whether they are rich or poor, they watch movies, and in movies they smoke, they consume alcohol, and a small this one message comes down that smoking is injurious. I think we have to give a strong message to our film industries that they should not promote it. So, and nobody makes any movie about the bad effects. The first ad that comes in the movie, it's not, they have taken patients and they have not taken any celebrities for doing that campaign. I think
So you
everyone
think
should follow this.
Mukesh ji is not a good person like to do propaganda. Mukesh ji is not
No, I
sufficient for you,
think that
right?
glamour quotient is not there. It's not glamorous to see a cancer patient. You don't feel like, that doesn't touch your heart. If someone, this Shah Rukh Khan or Akshay Kumar, they come in the Gutka ad, everyone, they like them because we do hero worship and we like our heroes or other celebrities. So I think why government should not bring a celebrity and do a campaign for no tobacco. I think we should go take one step backward. Instead of doing screening, you start preventing tobacco consumption, and once patient is already addicted, you have to take the help of multiple practitioners, psychologists, psychiatrists, and do the de-addiction. And I think the first step should be to prevent tobacco addiction.
Thank you. Thanks for the three panelists, like for the wonderful inputs regarding tobacco de-addiction and addiction, whatever the community care we can take to bridge the gap. And next, I'll go to the Gen Z topic, that's artificial intelligence, telemedicine, as well as social media. So currently, we are also part of social media. We're campaigning against increasing the lung cancer now. So, and during COVID, it's like very common for us to see like most of the artificial intelligence was used during COVID because lots and lots of imaging happened. So at that time, radiologists couldn't read the CTs or X-rays, whatever. So they used artificial intelligence, especially in Bombay as well as Delhi, most populated places. They used artificial intelligence. Could that artificial intelligence will be helpful to screen at the community level? For suppose patient underwent screening at the community level, sometimes they miss and treat as tuberculosis. Can integration of artificial intelligence in the radiology or like in any system will improve the early diagnosis of the patient with lung cancer? Can that be helpful? Dr. Shirish Alurkar, can you please take this question?
Yeah, see, the word artificial intelligence sounds very fancy, the very in thing. It is definitely feasible. It is doable. It requires thousands and thousands of images. All that. The thing is, how are you going to get that person coming to screen? That is the weird thing. So you're not going to get people coming to screen themselves, or tell that, "Oh, I may have lung cancer. Screen me. Do a low dose CT." It's only we have. So, if at all, yes, if there's a good awareness, if the public is aware of coming, they come forward, then definitely AI would be there. But that requires a
Yes.
lot of patients coming, a lot of images to them. Then only it works.
So if our patient awareness increased, the patient started getting undergoing screening. So then you think that artificial intelligence will play a major role to detect the early cancer. Is it, sir?
I think so. Yes, definitely. It is doable. It is. There are definite
Yes.
algorithms. It can be done. Yes.
Dr. Lalit Mohan Sharma, any first-hand experience during COVID, and what do you feel if ever it got implemented? Will artificial intelligence will helpful to improve the diagnosis of lung cancer at early stage if ever screening is happening in the community?
I am sure that in fact in my lifetime I will not see practical applications of artificial intelligence in early detection of lung cancer. I am very clear about that. So
So
we are in
practical,
fact talking
yes.
we are talking too optimistic and too hypothetical if we talk of AI based early diagnosis in lung cancer. So to me it looks that this will not be a feasible option, and we need to understand our own ground realities. Where are we working? So here X-ray, CT scan, all that remains a very big dream. Doctors are lacking. In fact, in the rural area, there are no doctors even to see a patient. So we can't think of that. But of course, theoretical, yes, it may be beneficial if everything is being given.
Thank you, sir. Dr. Aparna, your take on this? What about
Yes,
implication of artificial intelligence in the early detection?
definitely. This teleconsultation, telemedicine, and artificial intelligence, they are all they may be useful in places where we cannot, a radiologist may not want to come and work in a PHC. So, if we can enroute the images to a person who's sitting, or if AI can report the CT scans, I think it's a wonderful thing. But that's a very optimistic image that we are weaving around this whole issue. But definitely, if we consider theoretically, it's going to be very useful, and it may actually help our existing situation where we have lack of manpower. Radiologists are not coming to smaller villages or smaller towns. So in that case, AI might be definitely helpful. But the our primary the point of discussion is how to get the patient, how to motivate him, and bring him to the hospital for screening.
Thank you. Thanks for the inputs. So all of us did teleconsultations during COVID to avoid the contact of patient with the hospital and doctor with the patient. So Dr. Lalit Mohan Sharma, how do you like what role can telemedicine or teleconsultations play in the management of lung cancer? Will it be any benefit to the patient in if ever beneficial, which situation the patient may get benefit? What's your take on this?
I think telemedicine remains a good option, but again, since we take many decisions when we see the patient in person. So if I am seeing a lung cancer patient who is not in front of me, I will not advise any definitive treatment because there are wide options of treatment available to that particular patient. So telemedicine is useful only if the person goes to a native place, and then for SOS, any problem happening, they can talk to us. Or if some primary care physician is involved at district level or other place who can take care of the patient, and then we can discuss in presence of patient. To me, I am very clear that telemedicine or teleconsultation will not be effective for management of patient. It will be just for a time gap arrangement, in fact, which we can do in emergencies.
Thank you, sir. Dr. Shirish Alurkar, your take on the same question.
I think we have to end the session very quickly. Yeah, telemedicine for a new patient, absolutely no. I would like to see the patient myself. One patient would like to see me. For a follow-up patient, yes, routine follow-up. We just want to do an X-ray or a routine blood test. How is he managing or toxicity? We can do that. But again, with a pinch of salt, because there could be some changes which I would like to do in my say treatment or chemotherapy, case to case or cycle to cycle. So I would personally like to see the patient every time. So just for getting the reports, sending the reports, fine. That's fine. That's the only limited use I would say as of now.
Thank you.
Dr.
Thank you, sir.
Kripa, Dr.
Aparna,
Kripa, Dr.
yes,
Kripa,
sir.
in fact, I think we are running short of time, so we need to do a little faster.
Sure, sure, sure. So I'll ask each one question, different question. So Dr. Aparna, like how can we use social media to run the campaigns against lung cancer? I mean, to increase awareness of lung cancer, like to increase awareness in the public.
Yes, social media. I think we should catch hold of the social media influencers. This younger generation. What we should cater to is the millennials or the younger generation who are very active on social media, and that is what they are the ones whom we want to target. So I think we can, even the government can actually campaign with the social media influencers and also celebrities and promote quitting tobacco. And we can do this giveaways, give prizes to people who have quit, and promote tobacco de-addiction or
Sure,
quitting
sure.
tobacco.
Yeah, thanks, Aparna. Dr. Lalit, I'll ask you this question. Over the years of your medical oncology practice, have you seen any change in the outcomes of lung cancer? Over the all years you practiced, did you see any change in the outcomes?
Absolutely. In fact, with the invent of various understanding of molecular mechanisms, availability of targeted drugs, we are able to see changes. And many times when I started practice, we were expecting the average survival of less than 1 year in majority of my lung cancer patients. But now I can see with the available drugs, available investigations, and better understanding of oncologists, we are able to see patients surviving for many years. In fact, like I had a longest survivor patient of 7 years plus. It was a 75-year-old lady who had some ALK positive lung cancer, and she survived for 7 years, which is amazing. So I'm happy that we are able to understand something, some particular subset out of whole patient, and there is a meaningful survival improvement.
All should understand this. Dr. Lalit is talking about stage 4 lung cancer. Stage 4 lung cancer outcome has improved over the years with the detection of new molecular targets and everything. So it's not like before. Metastatic lung cancer also still they can do well. Dr. Shirish Alurkar, so is early diagnosis of lung cancer impact society at a large?
Yeah, it will, because it will save a lot of stress to the relatives, a lot of stress on the health system, the cost. Many of these could be just, so for example, if it's stage 1 disease picked up, say, by screening, then you can just do say, a segmentectomy or a lobectomy and the patient is cured. So definitely, there's always advantage in catching it young, as they say. So it would have impact on the whole health system, definitely.
So did you see any increase in presentation of lung cancer in the early stage over your practice from the beginning to now?
No, unfortunately, no.
Unfortunately not. Okay, thank you. Dr. Aparna Sreevatsa, so is psychological counseling will be necessary for lung cancer patient? What's your thoughts on this?
Definitely, I think psychological counseling definitely helps when patient gets diagnosed. He may be a smoker, it's okay, but he is stressed. He is he has this threat that he may die any time. So I think counseling is very important. But where are the counselors? In metropolitan cities, they'll have a full-fledged team, counselor and psychiatrist and everything. But in my setup, there is no psychologist, there is no psychiatrist. I am the one who does everything. So I think we have to kind of stretch our hands and help them out. Psychological counseling is a very important part, and where
Thank
you
you.
can even sensitize them for de-addiction also.
Thanks, Aparna. Dr. Lalit, so what aspects you look for a survivorship in lung cancer? You just mentioned 7 years of ALK positive metastatic lung cancer survival. So if ever it is a curative versus metastatic EGFR or ALK positive, what things you do see? Survivorship like strictly meant for curative, but you already mentioned ALK positive lung cancer also will do really well for years to years. So what aspects you want to look into regarding survivorship of lung cancer?
I think for the cancer survivors, like Om Prakash mentioned, that each day should be like a celebration. And I consider that they should live, they may live with the disease, but in fact, the quality of life should be absolutely as near normal as possible. So they should live happily, they should have good quality life, minimal side effects of the drug, and minimum medications, which I expect that the patient should be having good quality of life, and they should live each day as if it is the best day for them.
Thank you. Thanks for the inputs. So, Dr. Shirish Alurkar, your thoughts regarding the same and also regarding patient advocacy groups. Do you have any encounter with patient advocacy groups in the society? What's your take on the importance of the same as well as the survivorship? What aspects you
Survivorship,
look into survivorship?
main thing is the quality of life and whether there is a loss of earning. So that is most important. So that is most important. Psychological also, the patient is, he feels well, okay, that he is doing well, at least he is earning. He may not be cured of the disease, but yes, he's earning, he's with his family, spending time, enjoying whatever little things he can. That is important. That is essential. Now, as far as the second question is concerned, the advocacy. See, unfortunately, Dr. Kripa, advocacy groups are very few, far and between. Like what Dr. Aparna said, counselors. Main reason I think is that there is a taboo in the society. कि मुझे cancer है, I don't want to come forward. I don't want to tell anyone. When we had, after so many years of practice, even my whatever, Dr. Sharma also would have a pool of patients, and we call the patients to come and so एक बार मिले, have a get together and you express your experiences or whatever. They said no बाबा, we will not come. It's not, we don't want to come. This is अभी भूल गए अभी हमको public में नहीं आना. So that level of awareness, I would say education, that whatever proactiveness is not there. Advocacy group, at least we see in Ahmedabad practically nothing. Maybe in Bangalore or Mumbai or Delhi, but Ahmedabad I don't see anything here.
Yeah, Mumbai, there is quite an active advocacy
There
groups
is,
are there,
yes.
as you rightly said, patients are not below poverty. People are not getting benefit with the advocacy groups, except the support system what they're getting financially. They're not getting moral support and awareness. Bombay, the advocacy group is really active, but not anywhere else. I do see a similar situation. Dr. Aparna, do you agree with me? Do you see advocacy
Yes.
groups in Karnataka?
Karnataka, Bangalore gets all the attention and cheers, but not other cities. I think it's a very important neglected part of the whole game.
I think VCare is doing a great job regarding the same, but not any other community is doing the similar kind of effort to improve the awareness. So, and before concluding the session, to all the viewers who are seeing this, watching this, if ever you want to get the information regarding lung cancer and its option, how to diagnose and how to get treated, what are the treatment options will be there for the lung cancer. There is a wonderful app called as Sahayog. You can go through the Sahayog website. All the information regarding lung cancer is there. All the myths can be broken, and you can access the healthcare worker. If any doubt you have, you can ask all the questions as per the information you got. Then Googling, better to go to Sahayog site and get the relevant information regarding the lung cancer from the medical group peers. Wonderful panel discussion, and I'm privileged to do the panel discussion with the Jains in the medical oncology. Thank you so much, and over to organizers.
Thank you.